Hello, Nathan. Hello, Anna. And thank you, Jennifer, for posting, and we'll get started. So, welcome back, everybody, to the monthly last Friday of the month Holistic Actions Q&As, where we will discuss the path to pet wellness that is paved with love, vitality, balance, and conscious connection with our animals. And I'm just going to put everyone on mute. Dr. Christina, if you could unmute yourself, and then we will get
There we
started.
go.
Um,
Okay, so here's the very first thing I want to start with, given that I am at the conference 20th anniversary of the 13 grandmothers, is I'd like everybody to take a few deep breaths. So breathe in and notice if it's your left nostril or your right nostril. Doesn't matter either way, or both. Breathe in and breathe out. Breathe in our connection with all life. Breathe in the connection with the food that you're feeding your animals. Breathe in with the water that's so important for each one of us, for all of us. Breathe in who you are, how you be, who you are for the whole planet, including those companions with you right now. Breathe in love. Breathe in no one right way. Blessings. I want to bless each one of you who is here doing your best, loving and caring. Okay. Now we're going to leap in. Come on back. And we're ready to go. Now, a couple of things. You can go to that place any moment, anytime you're stressed, anytime you're not feeling like things are going right. You can return to that moment. So, Jennifer, you want to unmute yourself if you can. Um, there's so much that can be done for kidney disease. And in St. Augustine, there are a few general holistic vets in that neck of the woods. So are you unmuted, Jennifer?
I am now.
Great. Are you working with a homeopathic veterinarian or a Chinese medicine veterinarian?
No.
That's the first step. So
Okay.
Are you a member of Holistic Actions?
I am.
Great. Go to the article on Select or put in the search Finding a Veterinarian.
Okay.
And if that doesn't seem to be, read the whole article and then do all the websites. And you can also post in the forum about finding a vet in the St. Augustine area. But also remember, and this is for everybody, there are a number of homeopathic veterinarians who can help you by phone. So it can be a combination, but often if you can have a holistic veterinarian as well who's nearby, especially with cats, one who does house calls makes it much easier for the cat. When we find the treatment that rebalances the energy field, along with sometimes supportive care like sub-Q fluids for kidney disease, the values may stay the same, they may go down, but the symptoms go away. I treated a cat that really fit the picture of one homeopathic medicine. Cat was 18 and had to be sedated to draw blood. Couldn't do fluids, couldn't do anything else. And with using that homeopathic medicine off and on for the next 6 years, the cat lived to be 22. Maybe he was 16 when he came to me. And the cat had a great quality of life, although still didn't want to be handled and get fluids. But so that's really your biggest key. And then the other is don't put out a lot of water. So put out a small amount of water. And once, hopefully, the amount that your cat won't vomit. and then refill it in another 10 minutes, another 15 minutes, whatever it takes during that morning time period. You could also, this is more for dogs than cats who are vomiting, but it could work with cats, is ice cubes. So they can lick ice cubes. Again, more dogs than cats. I haven't tried it with cats, but it's possible. Dr. Jeff, have you tried it with cats?
I have not, but regarding water, I really would recommend both for you and Nathan, who asked about kidneys for dog. Really recommend using a structured or trunk structured water for them both, and you can make that by soaking chia seeds, organic chia seeds, and I'm gonna put a thread in the chat at the Holistic Actions forum that will discuss structured water and how good that can be for.
And remember, even if you're not a member, you can read the forum. You can't, only members can post in the forum, but even if you're not a member, you can be there. And Nathan, the same thing. Definitely, you want to have a homeopathic veterinarian or a really good Chinese medicine veterinarian on board. And often ones that do other things as well, like ozone therapy or osteopathy or light osteopathy, light chiropractic. Those types of things can help regardless of the condition. So we'll keep hearing this all the time. And that's the main key. And for everybody right now, today, if you do not have a holistic veterinarian on your team that you're happy with, go to, if you're not a member or a member, but if you're not a member, just go to holisticactions.com/select. Read the whole article. Make that your job for the next few days, the next week. Make that high priority right now to get somebody on your team. It's just critically important. Nathan, anything else in addition to what we've suggested?
I would love to know if you recommend anything related to diet, nutrition, supplementation when it comes to like kidney healing as well.
Well, the most important is to be rebalancing the energy field. And then second, in terms of the diet, fresh food as opposed to processed food. And you don't have to worry about the protein level. That's if you're using not very good commercial food, you have to maybe worry about that. So fresh food, and particularly whatever they like to eat, you want to really be catering to them, as well as making sure you've got calcium in the diet, and, doing a basic diet. And in the 101 course, we talk about nutrition. And then we have lots and lots on the forum about specific foods, specifically how to feed, but there's nothing specific in terms of foods. Dr. Jeff, supplement?
Yep, I added the Avente Kidney Complete in the chat. There's a link.
Great.
I'm not sure if you can get that in Germany, Nathan, but it might be available to you, and that's gonna balance out the microbiome. It's gonna help reduce phosphorus. It's gonna just balance things overall. But Dr. Christina said the most important thing, which is, we want to focus on, and I'm hoping this isn't Trip because he's such a young guy, but whoever it is, focus on what they love to do the most, what they love to eat, what they love to do activity-wise, because in that sweet spot, in that place where they're in their joy, in their happiest moments, that's when their bodies are always going to work better than anything else. And that actually is what homeopathy does. It enables the body to be in that place at all times, and
And
heal optimally.
there are homeopathic veterinarians in Europe. And when you read that article, it has a list. It's got the International Veterinary Association, and there are members there. There's one in Don Hamilton is currently he does phone consulting from Europe. And did he move?
Well, I was going to say, isn't he in Austria?
Yeah, yeah, but he's in same time zone, same area, so makes it easy. Okay, so shrinking growths on anywhere on the body can be really a challenge. So Art, you want to unmute yourself? And the first step, of course, Art, is what we've already talked about. Feed the best diet, find what makes them happy, and get a holistic veterinarian on board, a homeopathic or good Chinese medicine veterinarian on board. So Art, are you unmuted? It sort of depends on what the growth is. So Art, when you are ready to unmute, why don't you raise your hand and then we'll come back to you.
And you do that by hitting the react on the bottom of the screen, and it will just raise a little virtual hand. And we skipped and asked about Buddy and what
Oh,
his
yeah, I did.
treatment would have looked like. Buddy was, if you remember on the forum, Buddy was the pup with the brain tumor that I think Anne recently had to
Had to put him
euthanize.
down. Yeah. So here's the answer. Here's, basically what Anne's asking is, what is it that we can do to prevent our animals from ever getting sick? And there is no one right answer, and there is no one right thing to do. The 101 course gives you an overview of things that can help and move us towards having good health, like feeding a fresh food diet, really paying attention and observing your animals for any early warning signs, paying attention to their happiness level, their proper exercise, etc. However, every animal's different, and we're on a soul journey. And sometimes there's an end point, and they become ill with something that to help them transition. So yes, there's sometimes you could have done something early on, and other times nothing you've done is right. There are animals on crappy food that live a long life. There are animals on great food that come down with cancer. And every animal has unique sensitivities to different things that can trigger them to produce the symptoms. So that's the best we can do answering that one. BKG, working effectively remotely with a homeopathic veterinarian particularly is really wonderful. And one of the keys is, and if you want to raise your hand, if you want to unmute yourself, BKG, go ahead. One of the member benefits is the Healthy Dog Journal. And if you're not a member, you can go to my website, ChristinaChambreau.com, and purchase the Healthy Dog or Cat ebook there. And I also have articles. We have it at Holistic Actions, but on my website, if you're not a member, on keeping a journal. If you don't buy that or use that one, just keeping one in general. The idea is we're paying attention not to the symptoms that are concerning you the most. And this is an answer for everybody. And it even goes back to answering Anne in terms of how do we stay on top of what might be causing problems. So you make a list of all symptoms that have ever been present. And then after every treatment, after everything you're trying to change that animal, whether it's playing and laughing with them or changing their diet, you then reevaluate all of the symptoms. And at Holistic Actions, we teach you about the homeopathic responses to treatment. And Don Hamilton's book, Homeopathic Care of Cats and Dogs, talks about it. So cure, palliation, or suppression. Are you moving in the right direction or not in the right direction? And the other thing with working remotely with a veterinarian is to make sure you've scheduled your follow-up appointment. Whenever you have an appointment, make sure you have a follow-up appointment. Find out how can you contact them if symptoms change, email, text, etc. And then by being a member of Holistic Actions, you can post in the forum, this has changed and I'm now worried. and we can help you decide if that's something to worry about or not. And you'll also hear from other people who absolutely have been there and tried different things and can help support you. Ruth K wants to be as holistic as possible. Have her take the 101 course, have her become a member. And in terms of heartworm preventative, in my humble opinion, none of the things that are out there for preventing heartworm with herbs or homeopathic nosodes or amber or any of the others actually prevent heartworm. What's happening is they may be building up the health of the animal. So the dog is naturally, his immune system is getting rid of those migrating larvae. So the other thing, Ruth, is make sure that in terms of her making decisions, she has read about the heartworm cycle and knows how it works and knows how the heartworm preventative works, which is not a preventative, it's a morning after pill. So that's the best for her. And then you can post that question on the forum as well, Ruth. So now we have Susan. And so this is wonderful. Number one, so Susan, if you want to mute yourself, that's great. So Susan's cat is 15. That's wonderful. We have cats living past 30. I know of one of 38 and multiple that were 29 to 34. And the floating cartilage may or may not cause any problem at all. And if he doesn't seem to be any pain, the main thing I don't think it's a homeopathic jump for joints.
Yeah, it is. It is. It's
Is
arnica,
it?
Yeah, it actually
arnica
does.
and something else. I forget.
Okay. Well, I would
Because I think he was in pain. He was limping, so but I don't think he has him anymore.
So again, when you're using combination homeopathic medicines, they're good for acute problems, but you don't want to keep giving them for a long time. They've never been tested or proved. So if new symptoms appear, you don't know if it's from that or from something else. And often they are temporary help. So the other thing I would do is, as I talked about, is working with a homeopathic vet for a deeper constitutional treatment. And then that will help you with single remedies if you need for an acute problem as well. And if he's happy staying upstairs, that's great. But if he's not happy, then you might want to experiment with carrying him downstairs and upstairs periodically.
Well, yeah, I thought about carrying him downstairs, but he seems happy and I don't want to stress him out. So
great. As long as he's happy, that's really good. The other thing is I would go to Laurie McCauley's YouTubes. Have a number of, and a lot of we've had several webinars that are on exercises to help animals. And they even have some with cats. And so having motion, trying different movements to build the muscles and keep the muscles strong, that can really help with joint problems. So I would definitely do that. And I would also work at things like Tellington T-Touch, massage, range of movement yourself. So those are other ones. And we've talked about those again in webinars, or you can go, or Dr. McCauley's site has that. And there's some other sites as well. And that's the main thing. And then make sure you're doing all the other good stuff.
right. Great. Well, thank you so much.
You are welcome. Anna, you are next. So a 2-year-old Havanese. Anna, are you a member? I think you are, aren't you? You want to unmute yourself, Anna? You're muted, Anna. There you go.
Hi.
Hi.
Thank you so much for this session. I can't believe the timing. I just got off of speaking with my daughter, and she's in stress mode because she has gone through a couple of actually a month on and off where Our Havanese Lola basically was vomiting and had diarrhea for the longest time.
Right.
And then after several tests, which all came back positive, I mean, came
Okay.
back not
Not
negative,
bad.
meaning in a good, yeah, like her blood levels,
Yeah.
her blood cells,
So
white.
here's the thing.
Yeah.
Where does your daughter live?
We're in Montreal,
Okay.
Canada. Yeah.
Okay. So there are actually not a ton. There's one good homeopathic vet, I think, in Montreal, but there are some. There's one between Ottawa and Montreal as well. But
Okay.
you can work virtually. One Canadian vet who works virtually is in Calgary, and that's Wanda Vakaroth. Maybe you can put that in the chat, Jeff. And so everything I've said so far is what's important. And the high fat diet probably did not cause that. Anything from a conventional vet, it's good to get a diagnosis. I'm not even sure that's what's going on. We need more details. The most important thing would be to be, are you a member?
No, but I'm thinking of becoming one just because we're so desperate that we can't find.
I think it'd be really important to do that and post in the forum everything, and then we'll get you specific details. Were you feeding a fresh food diet before or a processed food?
No, it's fresh food diet. It's raw.
Okay.
Raw diet, but we didn't make it ourselves. It was already.
Okay.
It's from a farm, Tolden Farm.
Great. I would feel fine. I think it would be fine to experiment with do one day on that while you're feeding this Hills, which I don't think is particularly great food. Do one day on that, see what happens. And then slowly go back to the raw diet.
Okay, it's just we need to find a raw diet that's very low in fat, I assume, right?
No.
No?
There's a big difference between fat in processed food and fat in a fresh food diet.
Oh,
So
okay.
you don't need to worry about that. And be sure all the things we've talked about, happiness, dancing, exercise, all of the things that just make an animal happy, that's important. And of course, avoiding toxins. Be sure you take the 101, both of you take the 101 course, because that'll get you grounded.
Yeah. And could dandelion also, dandelion and milk thistle help also?
Those are both supportive and may help. But the key is get yourself, go to the selective vet and get yourself a homeopathic or really good Chinese medicine veterinarian to be helping along with all of this. And then I haven't talked about this yet, but for all of you, energy healing is critically important for each of you to know something. And again, we have a lot of webinars on Eden energy medicine, flower essences, Reiki, scalar, multiple ways that you can help soothe any of the symptoms that are going on.
Mm-hmm. Okay.
So is that enough to get you started? And look, hopefully we'll see you soon at Holistic Actions. You can post in the forum right away.
Thank you so much. It was very much appreciated. Thank you.
Absolutely. Very good. Okay, so Lorna, we're back to kidney disease again. So Lorna, can you unmute yourself? And did you hear our answers for the previous two kidney problems?
No, sorry, I missed some of that.
Okay, so basically for kidney disease, are you a member of Holistic Actions?
No, but I'm going to.
Perfect. Okay, well then post in the forum. And also, as a member, you'll go to the member resources to the library. We have a whole section on kidney disease, and we have multiple webinars, as well as articles and specific things for kidney disease. So at this point, he's on homeopathic medicines. Now, are you working with a homeopathic doctor or doing this on your own?
No, I'm working with, she's a homeopathic, she's not really a doctor, but a homeopathic person.
And what's her name?
Sarah Griffiths.
Okay,
I'm in Vancouver area of BC.
Okay,
I
So-
was seeing another one, but she got so busy.
right.
And then
That's also
unfortunately, and that's the thing now with Sarah. Now Sarah's been sick too, so it's really hard.
uh-huh.
And then he's been in and out of hospital 3 times this year. So I have an internal medicine doctor, but of course she doesn't believe in anything homeopathically.
Right. Yep.
So it's really hard because I can't.
It is absolutely. You may want to try a different homeopathic veterinarian since Sarah's been ill, and shift
Yeah, I
over.
can't seem to find anybody at all
Wanda
in my area.
Vakaroth in Calgary does phone consults. And if you go to our article, holisticactions.com/select, you may find other ones that are doing, even in BC, that are doing virtual. So that would be your another step.
And I think Julie is actually in Vancouver. I was just looking it up right
Julie,
now.
okay.
Oh, her name is Dr. Right, yeah, I've got her in Vancouver actually.
I had a
Here's
fabulous one that, of course, she was great for my other cat, but then she moved away. And I've tried to contact her in California, but she can't really help me, she says.
Okay.
here,
Yep.
so-
That's why we've given
Yeah.
you multiple options in the article. Be sure
Yeah.
you read the whole article, and
Okay.
Dr. Jeff will look for that and post it in the forum for you.
Yeah,
But do you know
Then
why
there
his
also-
belly would be warm? Like, no one will give me any answers for that. It just seems to be.
Well, warmth is an individual. There's no one right answer for that, but it's your cat's response in trying to heal itself. And one of the things you want to be doing is keeping a journal, which as a member,
do.
you'll be able to get that for free. And notice when the belly gets warm, is that after you've given a homeopathic medicine? Is it when something else is going on? So there may be a correlation to it being part of the healing or part of not feeling good. So you'll have to do your research to find out about that.
Yeah, I do. I keep a journal. I keep track of all
Okay.
his food, his
Well,
peas, his poos, everything. So,
That's
but
great. Excellent.
it's just.
But
no
that's
one
how you
seems
want to look at it. There, again, the warm belly can be the body responding to a treatment to heal itself. Inflammation is part of healing.
Okay.
That's one possibility. The other possibility could be there's inflammation because something is triggering at that moment the bladder to not feel good. And so you're feeling a radiation from the bladder. It could be, so as you can see, there are multiple possibilities.
Holistic pet Zoom meeting.
Okay,
Okay, thank you.
got your next steps. And there are certainly supplements, lots of supplements that can be used for kidney problems. Like renal support from Standard Process.
I
There's
have that.
Dr. Jeff has already mentioned other ones, but those are all helpful, soothing. When you have a serious illness, you need to be as you want to be doing. So now you know how to find another vet, another homeopathic vet.
Thank you so much.
That's your most important piece. Dental. So number one, don't worry about anesthesia in older cats or dogs. Anesthesia in general is very, very safe now. Didn't used to be when I was 45 years ago when I graduated. We did have to be careful. Now, intermittent bad breath may or may not be from teeth. So you need to know if you really do need dental cleaning or not, especially with it being intermittent bad breath. And if there's early kidney disease, then you want to be addressing that with everything we've already talked about. Now, hypericum is particularly good if you do have dental work done. Hypericum is a homeopathic remedy that's useful anytime there's nerve-rich areas, which the gums are full of nerves. And so hypericum can definitely help with that. So that's and of course, if you're starting with early, like I said, you want to be sure you've got a good vet. I just do want to say one thing, Noelle, about animal nutrition courses. What Dr. Jeff and I have discovered over our multiple 80 years together, 70 years worth of practice total, is there is no one right answer. Every animal is unique. And many of the coaching and nutrition programs are saying there's only one way to do it. They can be great courses. You can learn a lot. I don't have any one particular one I recommend, but you will learn a lot from any one of them. But you have to remember that they're not the only answer. That's really important. Yes, Jennifer, high protein, fresh food is fine for cats with kidney problems until they reach a certain level of creatinine and BUN. There can be a point where even holistic veterinarians believe you have to start cutting back on the protein. But if you're working, but that's way up there. I don't even have a number for that because it has to do with the other symptoms that are going on as well. But feeding fresh food, you don't need to worry about that. And yes, Whitney, sometimes essential oils can help shrink lumps and bumps. The lump on the leg could be a lot of things, so we weren't able to really address that specifically. Tina, you know the answer. Chinese medicine, really good Chinese medicine or homeopathy. I like standard process heart supplements. They're actually, you can do remote. We have, if they become a member of Holistic Actions, they can learn the heart health exam. So they can actually be examining their dog at home, because that way they can track what supplements seem to be helping the most. There's a lot, there are flower essences, there are herbal combinations, and that can support, definitely can support the heart. And Thorn also has good supplements as well.
Yeah, that was the real. You're right. I mean, I know there's other things that was really the question, was kind of how do you feel about Thorn versus, I mean, as far as supplements, because
I personally
things to do.
Personally, I like standard process better than Thorn, but that's just a no. That's not based on anything. Just my personal.
In general, you're talking about, or for heart
Yes.
supplements?
No, just in general.
Okay.
Dr. Jeff?
Yeah, I would
think you
have
have
to
a
agree
comment?
because the difference is, Thorne is focusing on these concentrated individual ingredients, and standard process is really more focused on whole body, organic, natural nutrition-based supplements. So yeah,
Okay.
if you want one that's
Sorry,
more like a
my
drug, is Thorn. Thorn would be
Okay.
more like a drug. Standard process is more like the whole body balance approach.
Okay.
Great.
Thank you.
You're welcome.
And the
Nathan?
question was for a dog who I was just going to say, because you always ask, and I forgot to put it in there. The dog is on whole food.
That's good, but it also needs homeopathy or TCBM to really do it. You're welcome. Nathan, the difference in feeding protein or not protein to kidney has to do not necessarily holistic versus conventional, but diet. Fresh food versus processed food. Any other comment to that, Dr. Jeff? For Nathan?
No, the big thing in general is just what you said, the ultra processed commercial food versus the fresh food, but it's really not even the protein that's the problem, it's the phosphorus. Which is why the Aventi phosphorus bonder that I put in the chat a while back, it's a good thing to add no matter what diet you're using. Phosphorus is, getting above 5, or if it's up there at 6, which they call abnormal, but anything above 5 is, it's getting too high for the kidneys because the phosphorus can be a direct toxin to the kidneys.
Okay. Yeah, I was
Excellent.
curious why I guess conventional vets, this sounds like it's more than conventional wisdom, even encourage fresh, like reduction of fresh protein, like meats, like even like raw meat, like reducing.
It has to do with the digestion. If you're feeding crap, then the body can't properly absorb the protein. If you're feeding fresh food, their body processes the protein without the byproducts, without the toxins that are affecting the liver. That's the difference.
Yeah, I'm
Well,
sorry. I guess I was just curious about it seems like the conventional wisdom is even with fresh, like all sources of protein. Is it your opinion basically that they're basically
No,
just inflating the
they're
conflict?
just not educated.
yeah,
Sorry.
it's old research, Nathan. I mean that's kind of like the people that say, "Oh, you got to get your pets spayed before they're 6 months of age." Well, that was based on a study like 50 years ago, or
Okay.
now it's 60 years ago. Yeah,
Right.
one study, and now they know that's not true.
But
So
they're
like
still teaching it in vet school. So
okay, so like the underlying aggravating factors for kidneys lies outside of diet as long as it's kind of like a whole food fresh diet. Like there are other factors
yes.
that
Yep.
are okay.
Which is why you need to address the energy field, because each energy field is uniquely triggered by different things, whether it's toxins or EMF or genetics or the epigenetics, the multiple things that can trigger it.
Okay.
And I'm glad you said that because we haven't mentioned the one big difference between fresh and processed food, and that's vitamin V. Because vitamin V,
Vitality.
vitality, the energy in the fresh food is far above, and even the raw food is above, cooked food.
Yeah.
So yeah, you want to focus on that and joy and love and happiness and sniffing and all the stuff that we've talked about, Nathan.
Okay, we now have 15 minutes and 20 messages. So I am going to be quick and dirty now, answering. July, post in the forum. Art, since the growth is benign, you can try essential oils. You can work with all the things we've talked about in general to build health. You can do acupressure, any of the energy healing approaches. So you can play around with that. But building health and vitality, often those growths will start going down a little bit, or at least won't grow very fast. Kelly, it could be related to the eye creases, different minerals. And the reason I'm saying that is it might affect the tears. And that's why it's in the eye creases, is because it's the tears. Jeff?
Well, remember, there are people that are hearing or watching that they're
Right.
not seeing the question, so repeat the question, please.
So that's why I said losing hair in the eye creases could be from the tears. And the hair analysis showed a heavy metal load, could be related to that. And it could be an energy field imbalance that's triggered by whatever that's affecting the tears, that's affecting the what's underneath the eye creases. So briefly, we don't believe in plucking dog's hair in the ear because very rarely is it needed. It causes inflammation, causes pain, and can actually set up infections. Now, if you have a dog with really heavy hair, sometimes you need to trim some of the hair in the ear. Dr. Jeff will post which specific muzzle mat is needed, and everybody who gets this will also get the chat, so you'll get the links. And we have a huge, as a member, go to the talk by Judith Shoemaker about 2 months ago about mobility, and she talked a lot about nails being trimmed. If you're not a member, you could go to search the forum. I think we talked about it there. And there are some YouTubes by Dr. Shoemaker and Dr. Karen Gelman on trimming toenails. And then there's a really good one by Dr. Busby, Buzby. And her she has a number 1 and number 2 video. The number 1 is how to hold any dog to have their nails trimmed. And the other thing is you take your time to train the dog to love having the nails trimmed, along with training everybody here. Make sure you train your animals to love having everything be done. Open the mouth, look in the mouth, look in the gums, clean the teeth, clean the ears, trim the nails. It can be done with 95% of the dogs and cats with lots of patience. And I'm so sorry, BKG. So again, there is no one right answer. And when we have a serious ailment, sometimes it's just the end of the genetic lifespan, and it's something has to give at that point. So it's a reminder, enjoy every moment of their life. That is really important. And we've gotten in the chat, for those of you asking about veterinarians, we've gotten a recommendation for Montreal. We've gotten other ones. Susan had a dental because of a broken tooth. Okay, great. Well, that shows, and he came out of anesthesia very well for his age. So that shows how well he's doing. There are, by the way, if you become a member and take our homeopathy course and do the years of homeopathy that are in the forum and the webinars, you'll find specific remedies for things like not coming out of anesthesia very rapidly. There are things to do there, along with flower essences. Hotspots. First off, this is good because we haven't talked about it yet here. If there's a skin problem, be grateful for a skin problem. Skin problems are wonderful. It's the energy field being healthy enough to push the problem to the outside. Don't try to suppress it. Dr. Jeff mentioned fresh and organic aloe vera. Also, brown lye soap. If it's oozy, if it's really oozy and yucky, brown lye soap just
This meeting is being recorded.
Just smudged on it and kept there, and that'll keep them from licking it, and it eats up all of the discharge. So that's another one. With Lyme disease, you may or may not need doxycycline. The definition of Lyme disease is not always accurate. It just means sometimes just that there is Lyme antibodies, which means they've been exposed and done things. So it has to do with symptoms. Don't pay attention with lab numbers particularly. It's more important to do symptoms. Liz, I'd suggest becoming a member. We have a whole Lyme disease course. And at some point, I think that'll be available to purchase separately if you're not a member, but it's a member benefit. And then you can actually post in the forum. And the gastric reflux, it depends partly on what you're feeding. So pay attention to the diet and how she's eating to do with the gastric reflux, when it comes in relation to what you're feeding, maybe experiment with some different foods, some different ingredients. Art Stewart, I would not be giving Hepar sulf on a regular basis. And if the lump is, Hepar sulf is generally for very irritable animals that are very chilly, have become chilly since becoming ill, or it's an abscess. It's an inflammatory process. So a benign lump doesn't sound necessarily, it could be, but it necessarily is that. So Anne, and to everybody, if many holistic approaches are fine with conventional drugs, and often we can wean them off conventional drugs. However, we tried not to. And when to decide to have an animal euthanized is an individual decision. And in Buddy's case, we know enough to know that it was not too long. And sometimes you can work with an animal communicator, but they don't have the right answer either. The most important thing is not to feel guilt for anything you've done in the past, because there is no one right answer, and we're all on a path and on a journey, and we all do things that work or don't work. And the worst thing you can do for the universe and for the spirit of the world is to feel guilty for too long. I say ever, but maybe some guilt's okay. But basically, I'd say don't ever feel guilty, and really work at not being angry also. Colitis, cats with colitis, definitely you want to work at the microbiome, whether it's by Adored Beast, which has easy to give microbiome supplements or capsules from Animal Biome or Dr. Margot Roman's solutions. CoQ10, don't know about that one particularly for colitis, could be. But the main thing is to find out what's going on. Is it the diet? Are you feeding a fresh food diet, etc.? And then working with the underlying vital force. And man, we actually now have extra time. We can go back to people that we didn't answer you fully.
So I do think it's important to have the discussion about what Nathan was asking about. Do
Yep.
viruses,
Go
bacteria,
ahead, Dr. Jeff.
Yep. Do they cause disease or the cause of chronic disease? And that's a great question, because animals have stronger ability to live in their bodies than we do. And viruses and bacteria usually are not the cause of any problem in dogs and cats. The balance of the terrain is more important than the individual germs. So it's pretty unusual for us to even see. Actually, I don't know of any chronic issues that are truly caused by that in animals. Acutely, yes. But even acutely, I mean, myself, I had severe Lyme disease. I never took antibiotics, and with the remedy with homeopathy, I was fine within a couple days. That was decades ago, and I don't think I've had too many chronic problems ever since, even though I know that we say that Lyme is always going to be in your body. But anyway, Dr. Christina.
Yep, totally agree. And then the other thing is holistic ways to boost the immune system is nutrition. Feed fresh food, variety, experiment, try different people's ideas on it. Just like with people, remember, people have, how many different ways are there to feed people? Macrobiotic, vegetarian, vegan, intermittent fasting. And does one of those right and work for everybody? No. We do know fresh food is best, bottom line. But other than that, there's so many different approaches, and all of them can be good. Same thing for our dogs and cats. So nutrition, feed the best, and figure out what's the best for each animal. And in terms of supplements, we like to minimize supplements and get most of our nutrition from the food. Now, having said that, everybody has different opinions. And one of the joys of Holistic Actions is we have speakers with very different opinions. So we have speakers that say you need to be giving omega-3 and this and that and that. Others that say you have to do minimal. Others that say you need to do something to make up for our crappy soils and crappy water. So maybe you need to do blue-green algae or spirulina or some of the just basic boost the nutrition system. So there's no one right answer in terms of that. Goat milk is full of microbiotics. It has great bacteria in it, like better than cow's milk. And so raw, definitely not pureed. I guess powder could be okay, but raw goat milk would probably even be better. So that would be really important, and to help build the microbiome. And it's also nutritious, and a lot of animals really like it. There are also fermented goat's milk, fermented beef broth, chicken broth, fish broth. So those can also be good for helping to build the microbiome. Anna said that they also found small amounts of water in her uterus, and therefore wanted to spay her. So that's, again, oh, here we go. Depends on the circumstance. So again, as members, we have Sarah Chapman. Dr. Sarah Chapman did a wonderful course on spaying and neutering, and new information is showing that it's probably best not to be spaying and getting rid of the ovaries and getting rid of the testicles in dogs. And however, and even AHVMA, I mean, the AVMA, Regular Veterinary Medical Association, is offering the options of ovary sparing spay. So we'd have to know a little bit more about what this water in the uterus was about. But you don't need to jump immediately to that because the conventional veterinarian says you need to do that. You need to look at the whole context, either in the forum or and working with a really good homeopathic or Chinese medicine veterinarian. So, oh, good. Thank you, Rachel, for sharing. Oh, thank you, Nathan, for sharing with Rachel. That's wonderful. And Dr. Jeff, what do you want to say about pemphigus vulgaris?
I just want to point out what Nathan's experience was, that autoimmune is often either a misdiagnosis or a garbage can diagnosis, but basically, we're always looking at immune balance. And whether it's allergies, whether it's colitis, whether it's kidneys, whether it's pemphigus, whether it's cancer, got to get that energetic balance back in check. And really, the methods that we're talking about work for all these things because they all work on focusing on the flow in the body. So yeah, so pemphigus will resolve. Most things will resolve with proper energetic treatment. But that includes fresh food and good lifestyle and all the things that we talked about. But I just want to add for Jamie and the colitis cat, don't forget fiber, 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 fiber. Because that's really, key for colitis in cats and dogs and people, actually.
And also, I just want to remind everybody that if you're feeding a fresh food diet and you're making it yourself, which I think is the best, is make sure you're doing calcium. Okay, that's the one supplement that we all agree on. You're either feeding bones that have meat on them, like chicken necks, chicken backs, it could be rib bones, or you're giving a calcium supplement. That's the one thing, just as a quick reminder for you on that. And again, really, really, this observing your animal. What do they want and need? What do they want and need for their happiness? What do they want and need for their food? Giving them choice. Our last couple of speakers were talking about choice. So you want to find out if they're going on a walk, which direction do they want to go? Give them a choice. If you're petting them, stop petting for a second and say, do you want more? If you're petting all the way down their back, or if you're doing Tellington T-touch, you're doing massage, whatever you're doing, or the veterinarian's doing something, or the animal healer is doing something. If they don't like it, don't do it unless you have to. I mean, of course, sometimes you have to. But this observation of what do they want is what's really important. So you want to keep up with that, and the loving and the caring. And I'm just going to type two things in the final words, Dr. Jeff, while I type something in the chat.
Final words, or I guess how it's say love and joy. Love and joy are really what they live for and what will help them get better because our unconditional love is the most powerful healing energy that there is. And if they can spend more time in their joy, in their happy spot, they will they will get better. And they do get better. And we have hundreds, if not thousands, of examples on the forum of dogs that were paralyzed, that had cancer, that nothing else was done except prayer, meditation, and getting the dog in or cat in that zone where they were.
And on YouTube, we have a wonderful interview with Dr. Bernie Siegel, who was 93 when he did it. And he talks about just love. And he went to the vet with his dog. And I don't know what was wrong with the dog. And the vet said, we need to euthanize him today. And Bernie succumbed, didn't think for himself for a moment, called his son and said, tell everybody to come say goodbye to whatever the dog's name was. And the son went, Daddy, we don't do that in this household. Bring him home and we'll just love him. And I'm sure Bernie went something like, oh, duh, I didn't think about that. He didn't say that. And the dog lived another 4 years. So that addresses the earlier question also about, when is the right time and did you wait too long or not too long? There's just another example of we never know. And for cat people, check out brighthaven.org. Lots of wonderful stories there. So if you go to our YouTube for Holistic Actions, the webinars are a member benefit, but sometimes they're open to everyone. And so we put those on YouTube, and be sure to hit subscribe. That's nice for our numbers. And that's it. We did it. We got through everybody's questions. Thank you all for letting me rush a little bit there at the end, because I just did want to make sure we covered everybody. So have a wonderful day, and I'm going back to be with the 13 grandmothers.
All right. Thank you for being with us, Dr. Christina. Thank you all for coming. And I just put the link to Bernie's Love Medicine Miracles book is in the chat, and we will see you next month. Or if you remember, we'll see you on the member tour on Monday. All right. Thank you all. Bye-bye.